This is a guide to clean technique by me, Jasmine Polvera. First, let's go over the basics. In healthcare, clean is defined as the state of minimized infectious organisms, but we usually can't see these organisms, so how do we control infection? For all patient care activities, good hand hygiene is needed for infection control. This procedure should take 15 to 60 seconds. When using soap and water, hand washing may be anywhere from 40 to 60 seconds. Hand hygiene with sanitizer may be used for 20 to 30 seconds. Appropriate personal protective equipment, or PPE, should also be used for infection control. This can include gloves, masks, goggles, or gowns. What PPE to use can depend on the patient. Some patient care activities require special procedures such as clean technique and sterile technique. Clean technique is defined as efforts to reduce the number of infectious organisms in the clinical setting. A clean environment or field is where the level of transmission of infectious organisms is significantly reduced. In a clean environment, the sterile to sterile rule does not apply due to the use of both sterile and non-sterile instruments. Surfaces such as examination tables and mats are at risk for contamination. Any equipment used can also become a source of pathogens. These surfaces must be cleaned regularly, before and after each patient use. Using appropriate disinfectants will reduce and even eliminate pathogens. To establish a clean environment or field, first, clear a surface that is at least 1 to 2 feet away from other objects. Next, cover it with a towel or other disposable patient protective barrier. Finally, make sure all items to be used are on the clean area and stay in the clean area. It is important to plan ahead for high infection risk activities. Decide what PPE is needed and let the patient know what to expect during the treatment. Assemble equipment and supplies, including appropriate waste containers. Find an assistant if needed. Be sure there is adequate lighting in the area. Position the patient. Use PPEs to avoid contamination and help control infection. Perform appropriate hand hygiene. And finally, prepare the clean field and equipment for your treatment. Remember to clean up. Use gloves to handle soiled items. Place linens into the appropriate container for laundering. Avoid contact between linens and personal clothing. Do not handle linens in a way that spreads pathogens. And that's it for Jasmine's Guide to Clean Technique. I hope you enjoyed it, and thanks for watching.